Almost one-fourth of all people with HIV and AIDS in this country are age 50 and older, and the number is growing every year. The rising number of cases of women of color age 50 and older has been especially steep. Recent statistics show that in Florida, over 20,000 HIV/AIDS cases were diagnosed and reported in Floridians 50 and older, and cases were reported in every county. Here to talk with us about why and what can be done to protect yourself is Pansy East with AIDS Healthcare Foundation. Pansy, thanks for being here.
Thanks for having me.
Well, you're great at getting out information. Obviously, there's information that needs to reach these folks in this age group. Let's talk about that here in the next few minutes. First of all, before we get started, explain what is the difference in HIV and AIDS?
HIV is the virus that can lead to AIDS. HIV stands for human immunodeficiency virus, meaning you can only get it from another human. It is very similar to the cold virus. We can't cure it, but we can treat it. Full-blown AIDS has to have two things in common. It has to have an opportunistic infection, and it also has to have a T-cell count of 200 below. You want to keep people in HIV mode and not let them go into full-blown AIDS. That's why we want to test people early so we can get them in treatment and they can stay HIV positive before moving into the disease.
Okay. Well, we were talking about these rising numbers and just this large population in the 50-plus community. What do you see as contributing factors to this?
Well, there are many contributing factors, but a lot of the people who are growing older have the same concerns as young people, not having safer sex, not knowing their status, and I don't want to overuse the Viagra thing, but they have access to Viagra, and there's a lot of reasons. A lot of people who are getting older now who are maybe at risk when they were younger, and some of the risk factors are having unprotected sex, using needles, being exposed. So that behavior doesn't change as they get older.
Mm-hmm. Well, what about some of the generational aspects? Were these kind of topics talked about during certain people's childhood?
Not as much. I think we're more open about talking to our children now, and there's a special relationship between grandparents and their grandchildren now, and they open up more and they talk about things that are important to them. I mean, if we teach a child how to drive, we give an instruction manual, but when we talk about becoming a man or a woman or learning about the opposite sex, and sometimes we go blank, but we need to talk, and grandparents do that. Grandparents have a special relationship sometimes with their kids, so I think that's going to be our strong point.
Well, we're seeing a lot of situations where grandparents are almost the primary caregiver or provider for these children, and we want them to be having these conversations. Yes. If someone, like we said, grew up in an era where it just wasn't something that you talked about, how can they overcome that hesitation or get that information to make that an easier conversation with their grandchild?
Well, those are some of the services we offer at AIDS Healthcare Foundation. We offer classes to help parents talk to their kids. We offer classes for adults to make sure that they can take care of themselves. We also offer testing. We provide a wealth of services. You can come in and get brochures, information. You can call anonymously if you don't want to identify yourself. There's always an HIV counselor or someone there to talk to you. There's no reason for people to walk around and not have this information, and it's free. We offer free rapid testing. You get results in 20 minutes. We also have a pharmacy as well. HF Pharmacy is in the Sacred Heart Hospital.
Well, everyone should be tested, but what kind of symptoms, say someone hasn't or just hasn't gotten around to it, what might make them think, hey, I probably need to go do this?
The symptoms conversation is tricky because a lot of HIV symptoms are very similar to other things like catching a cold, so the only true way to know is to get tested. A person can be HIV positive and not show symptoms for up to 10 years. So you want to, if you've been exposed, if you had unprotected sex, you might want to come in and get tested. If you've had shared needles, or you've had tattoos and you don't know if the person used Clean Works, you might want to get tested.
Mm-hmm. Well, back to the senior population, As far as obviously pregnancy is not an issue.
Right.
So, but there still needs to be that protection. But what about maybe cultural habits or norms, whether it's patterns of behavior or feeling free to have conversations?
Oh, absolutely. I think having that conversation might be difficult for seniors because society was a little bit different, and people are more open about sexuality now, and it might be difficult for them to open up and talk. But what I said about getting the information, get out there and get online. There's great websites like the CDC. You can go to our website, AHF website, and get that dialogue going, because older people are not the same as they used to be. They look younger, they feel younger, they're living longer. I mean, it's really a new game.
Yeah, it's a whole new world.
You can't really tell a person's age anymore. You have to ask.
Right. So
seniors look great. Whatever age was, I don't know what the new name is now, but older, senior, whatever you want to call it, people look great. You don't even know.
Well, what about having conversations with their doctor?
Having conversations with their doctor is good, but we've had some cases where people came in and they might have been exposed and they didn't want to get their family doctor involved. So then they come either to our office or maybe the health department, because it gets tricky. You've had the family doctor all those years,
right,
and there might have been an exposure, and it's the privacy, the confidentiality thing happening. So I would advise them to come in and see us, totally confidential, and they can come in and unload, let us know what they're feeling, and we have counselors on board specifically for that.
Well, that is a very good point about that relationship that's been built up over the years with a family doctor, and that's another advantage to your organization and others. What kind of feedback do you get from the people who have come and were tested? We,
from our senior community, or just across the board, has been wonderful. We do testing everywhere. We have a mobile health clinic that goes out in 4 counties and as far as Chipley. We go to the jails, we go to the colleges, and the response has been great. We'll do classes in the jail and people will come out and get tested. So I'm just so excited. I'm over the moon about the progress we've made in such a short time. It just shows that there was a great need.
Well, you're always on the go out doing testing and education, and we really do appreciate that. If our viewers want more information, how can they reach you or the organization?
They can call 850-470-8071, and it's AIDS Healthcare Foundation. They can go to www.aidshealth.org. Just go to our site and check it out. We got billboards all over town with Blair Underwood's face on it, and we're promoting testing. He's our spokesperson for the pharmacy. Really excited about that. He's a wonderful person, and hopefully we can get him to come to Pensacola if he sees this.
Okay. All right. Well, we'll help you any way we can, because you're doing a great service for the seniors and for the entire community. So thanks for being here.